Hello, I'm Dr. Ellen Thomas. Over the years, I have had excellent experiences incorporating Niagara therapy in management of both acute and ongoing chronic conditions. In my opinion, Niagara's cycloidal vibration has many benefits that can offer support to sufferers of diabetes. Diabetes mellitus is a chronic disease in which the balance of the blood's glucose in the body is disturbed. In the stomach and intestines, food is broken down into several components. One of these, from carbohydrates, is glucose, which enters the bloodstream and is carried to the body's cells. Insulin, a natural hormone made in the pancreas, is secreted into the bloodstream in a response to a rise in blood glucose levels and is needed to help glucose enter the cells. It works like a key, opening up the cell to let glucose in. In the cell, glucose is used as the main source of energy. If the body produces little or no insulin, or does not properly use insulin, also called insulin resistance, the result is diabetes. The body requires a certain amount of sugar, or glucose, to function normally. Too much causes damage to the body's proteins and blood vessel walls, and too little starves the cells of sugar and prevents the body's cells from working effectively. Type 2 diabetes can sometimes be managed initially with exercise and a healthy diet. However, individuals may also need to take additional diabetes medication or insulin. Common symptoms include thirst, urinary frequency, blurred vision, cuts that are slow to heal, tingling or numbness in hands and feet, and recurring skin, mouth or bladder infections. People with diabetes are almost 3 times more likely to have high blood pressure, obesity or elevated cholesterol levels. They are 2 to 3 times more likely to have cardiovascular disease, renal disease and leg and foot ulcers. And most of the 3,000 amputations every year in people with diabetes are preventable. The complications of diabetes are varied. High glucose levels can damage the heart, brain, limbs, eyes, kidneys and nerves. Glucose can damage the many thousands of proteins that your body needs to function well. When collagen is damaged, it loses its flexibility, so your tissues, joints and organs are not well supported. In other words, your skin starts to age more rapidly and your joints become less flexible. High blood sugar levels damage nerves and the microvascular circulation. Diabetic complications are caused by high blood sugar levels damaging the capillaries, small blood vessels, and the organs dependent on them, such as the kidneys, causing nephropathy, the eyes, causing retinopathy, and the extremities, affecting circulation, which can lead to diabetic leg and foot ulcers, gangrene and amputation. The larger blood vessel wall damage, or atherosclerosis, the development of fatty plaque in arterial walls, results in heart and cerebrovascular disease, accelerated by high blood sugar and high insulin levels. The larger vessels become blocked, such as the coronary arteries, which feed the heart muscle, setting the stage for a heart attack, and the carotid arteries, which feed the brain, setting the stage for a stroke. These conditions can progress 6 times faster in those with diabetes. Further, a diabetic's blood has a greater tendency to clot, so that heart attacks and strokes are more common among them. The combination of numbness in the feet and poor circulation, both in the large and small blood vessels, make diabetics' feet and legs very vulnerable. Diabetes can cause immediate problems with fluctuating blood sugar levels reaching the brain. If the blood sugar is very high, hyperglycemia, a diabetic may become fatigued, have poor mental performance, and may develop increased confusion. However, these symptoms can also occur if the blood sugar is too low, hypoglycemia. Symptoms of hypoglycemia can also result in anxiety, fatigue, poor concentration, shaking, sweating, and heart palpitations. So now that we've heard about the complications associated with diabetes, how can Niagara therapy help you? The cycloidal vibration delivered by Niagara is different to any other type of vibration equipment currently available. The cyclo-massage unit has a suspension system which creates a three-dimensional cycloidal vibration rather than the usual single-plane vibration created by other types of massage equipment. The vibration is at a much lower acceleration rate compared to other average massage equipment. With the additional dimensions of motion and the much lower acceleration rate and hence lowered force of vibration, the massage penetrates much more deeply and gently into the body, creating a less aggressive result. A diabetic's tissue is very fragile and high acceleration vibration can traumatise and damage tissue. It has been documented that Niagara's lower acceleration rate does not cause tissue damage. Vibrations affect the body by way of stimulating sensory vibration receptors, triggering the tonic vibration reflex. After using the Niagara cycloidal therapy on a muscle, this reflex passively increases muscle contractility and muscle tone, so you achieve a greater muscle contraction response from the same nerve signal. This has far-reaching consequences for immobility, stroke, or any kind of rehabilitation, sporting injuries, and general exercise programs, and especially for those more frail, debilitated, or recovering from illness. Niagara's cycloidal vibration therapy has been proven to passively improve lymphatic circulation and enhance general blood circulation. The deficiency of nutrients and the direct damaging effects of high blood sugar and high insulin levels create inflammation. Inflammatory waste products create further tissue damage and fluid retention themselves, and this further reduces the ability of the circulation to carry healing nutrients to the tissue area. So they need to be removed as quickly as possible via the lymphatic and venous blood circulation. Niagara cycloidal therapy not only improves the removal of these inflammatory waste products, but itself improves the circulation, carrying oxygen and other healing nutrients to the tissue cells for repair. All health professionals know that improving lifestyle choices is critical to gain good control of diabetes. Making better food choices and improving exercise dramatically helps to control sugar levels, reducing the potential for tissue damage. There is evidence that good control of blood sugar levels can often reverse some of this damage. The Niagara cycloidal vibration acts as passive exercise on the body, stimulating muscle contractions, which utilises sugar for energy and improves the circulation, potentially enhancing sugar level control. Niagara has been proven to increase the rate of wound healing, including leg ulcer healing specifically, and enhancing tissue repair processes by increasing the rate of healing and regeneration of blood and lymphatic vessels. Niagara also helps with stress management and enhancing restful sleep, so that stress hormones such as cortisol, which can also contribute to increasing blood sugar levels, are not aggravating the problem. Research has shown that cycloidal vibration therapy in general has been able to decrease muscle spasm, hypotensive episodes, improve muscle responsiveness, increase blood and lymphatic flow, improve mobility in the elderly, improve general flexibility, reduce lower back pain, and improve joint mobility in osteoarthritis. Overall, Niagara therapy helps to offer a lifestyle improvement to all sufferers of diabetes.